Well, good morning back to everybody and welcome. It's really nice to be connected again. And just a short introduction, which is I'm Mark Schwartz and I run Harmony Place Monterey. And it's kind of a cool intensive outpatient program where we work with about 30 individuals who come. And it's a kind of a new concept because what we do is we do more than dual diagnosis. We do tri-diagnosis. We work with people who have chemical dependency, people who have mental health, and then subspecialty eating disorders and sexual compulsivity. And we have 3 separate tracks, and we have a certain number of people in each of those tracks, and we work with them intensely on the one and then the other. But the idea of it is that so many of the people, as one thing goes down, another one comes up. So we're able to treat them simultaneously or sequentially. And we see people 3 times a week in individual therapy and give them 6 hours a day programming, keep them for 2 to 3 months. So it really is a great program. Okay, just to begin, this is a new workshop, and I got a lot of fresh things to say, I believe. And I used to be a really good marital therapist. As I get older, I seem to know less. But I was trained by Masters and Johnson, and they were the best at the time. And then I spent a bunch of time with Richard Stewart, who wrote the book Helping Couples Change, if you haven't seen that, long ago, and to Neil Jacobson. And so I did cognitive behavioral marital therapy, which was in vogue, and got really good at it. And all of that work I found as I got more evolved was necessary but not sufficient. And then, as most of the rest of you, I was particularly influenced by Gottman when he began publishing, and love his stuff and incorporated it in. And then Dan Wiley, he's was my favorite. And so I do a Gottman, I do a Dan Wiley, I do a Jacobson, I do a Stewart, and then more recently influenced by Susan Johnson, of course, as she added attachment into it, and of course the Hendrixes, and the imago therapy. And I've done training with each of them, and as I did, I incorporated all that into my model. But I must say that all that was always necessary, but not sufficient. Some people got better and some people didn't. Some couples I would help and some I couldn't. And I think what influenced me more than anything was 30 years ago, I opened up a dissociative disorders unit, and I started working with people who had dissociative disorders. And it gave me a whole new lens of looking at couples. And that's really what I want to talk to you about today. And just to begin, I want to read you a quote, which was in a recent paper I read by Monique Verrier, who's in Oregon, which I give you a reference for at the end. She's a great article, and I just love it. And what she says, I'm going to read you something out of it. She says that Thomas Hara tells the story of a man who'd been in analysis for several years due to his problem of nail biting. When asked by a friend how the analysis was going, he proclaimed, "It was wonderful." When asked if he had stopped biting his nails, he answered, "No, but now I understand why I do it." That was exactly my experience, meaning Monique. I could have written volumes on why I did what I did, but I was still doing it, which added to my suffering. Now I knew better, but I was not doing better. I could see all the psychological threads, was hopelessly entangled in them. I saw how my psychological self was put together, but as I identify with this self, I felt destined to live out painful conditioned patterning, since it seemed like that to me. After years of therapy, I was functional within my culture, had a grasp on reality, knew myself as a distinct person, performed well enough at my job despite the constant anxiety, and could tolerate basic emotions. I had done a good job figuring out the maze and had worked out how to manage some of the trickier parts and dead ends. However, internally, I was deeply confused and suffering. Boy, is that articulate, huh? And I think I think that really kind of verbalizes what a lot of therapists feel, which is that the way they've been trained is really good at helping people understand kind of the why they do what they do and put the pieces together. But does it evidence change in their behavior? In my previous clinic, I had a eating disorder clinic, and I worked for about 15 years with anorexia and bulimia, and we did really, really good work, kind of textbook kind of stuff with the eating disorders. And the symptoms sometimes remitted, but they say it takes 7 years for a person to recover from an eating disorder. And some of my clients will write me down and say that when they sit down and eat the food, they don't even think about calories or weight or body. So I'm sure it can be cured, but I became sort of interested in what is it that allows a person to actually change the symptom and not just have insight. And, sort of what you hear in DBT, which is the goal of therapy is to help a person have a life worth living, not just to remove the symptom. I want them to be happier. And I'm not satisfied with just symptom removal. I remember once I said to Bessel van der Kolk, yes, we can treat PTSD, but does the client really get better? And what I mean by that is that you can do evidence-based treatment for PTSD, but the person can still be incredibly miserable. And we have to think in a larger way. So now I want to apply all that to working with couples. And I want to be able to say that I think that we're missing something. One of my clients came in a couple of weeks ago and said, Mark, I'm in this relationship and my girlfriend really loves me, but I don't know if I love her. And to be honest with you, I don't know if I've ever loved anybody. I don't think I know how to love. Now, I'm sure most of you have been confronted with that issue, or you've wondered with certain people whether they have the capacity to love, particularly if you deal with sex addiction, because it's almost as if the person is needs to have the big bang of the illicitness and doing something they're not supposed to do in order to feel anything. And also you wonder if the person's really numb, meaning that they're disconnected from their emotions in general, which a lot of men are. If you can't feel sad or can't feel scared, you can't feel all those deep emotions and feelings, can you really feel love? And I don't know, as we work with dissociative disorders, what you realize is that because of dissociation, some people seem to have neural networks that they seem to occur separately. And so they don't seem to have the neural networks that allow them to be able to love. So what that brings up, obviously, is what Hendricks and Susan Johnson grew to realize, which is that marital relationships actually activate a lot of the unfinished business from the family of origin. And so a lot of people, when they get into the relationship, they sort of regress. And the part of them that wants to be taken care of, the part of them that's really needy, the part of them that didn't get taken care of as children or had a misattuned partner gets into that relationship and suddenly projects or transfers or is somehow triggered to turn that partner into the family of origin person. And a lot of their fights seem to be really primitive. They yell at the other person, they say terrible things that they would never say to their worst enemy, to the person who they love the most. And you wonder, why is that? And so that's what this lecture is about, which is that what I believe really simply is that each relationship we're in has the possibility of allowing you to evolve to the next step of your own evolution. And what I mean by that is that if you have the ability to look at oneself and notice what is going on inside you, then what's happening, what gets triggered, is actually the next step in your own evolution. And so, I believe that there's a great book by Dan Wiley called After the Fight. And what he kind of writes in this is that a relationship allows you to go to the next step in your own evolution as an individual if you're able to look inside in some ways and be able to notice. So, for example, if I get really angry at someone, instead of just popping off, I'm able to stop and be able to look inside and say, what's going on, Mark? And what is it that's getting activated here? Is it about the present, about the past, or both? And I become curious about, what's going on with me right now? And I have the neural networks to connect to the part of me that's enraged and be able to be with that part and be able to sort it out inside before I pop off outside. And so I keep evolving, and good relationships allow that to happen, particularly romantic relationships, which we're continually learning and growing from in some ways. Now, for those of you who are sort of with me a little bit, the term that I'm really getting at is what Peter Fonagy calls reflective function. And reflective function, as you may remember, in childhood is when a parent can mirror the mind of the child and begin to be able to speak affect, which is allowing the child begin to understand more about their emotions. And so the child comes home and says, Mommy, why are all the boys mean to me? And you're able to say, well, that's because they like you. Now, how do you make sense of boys being mean to you, liking you? Well, that's a very complex concept for, a 7-year-old. And so what you do is you reflect and help the child begin to understand what's going on within them and for the other and how the world operates around in some ways. So reflective function is this, that the child's getting somehow a mirror of their emotions, by their knowledge, their intentions, the motives, and can read other people more accurately. So dad comes home and from a hard day at work and is irritable. Instead of saying dad is bad or I'm bad, you're able to say dad had a bad day at work and is taking it out on me, which is a pretty sophisticated kind of concept. Well, it turns out that reflective function is one of the factors that somehow sets people up to have a healthy marriage. And, there's a bunch of research now showing that if you measure reflective function, that if the individuals have reflective function, they're going to have secure attachment and they're going to have a really healthy relationship. So if that's true, then what must happen in therapy, which duplicates sort of the marriage, is that you have a relationship with the therapist and they get you and they're able to provide reflective function to help you understand yourself, other people, the interaction between you yourself and other people, and what's going on between you and them, and then how to operate in the world in an effective way. And that's why therapy works. And it's really important to know why therapy works because it helps you know when therapy is not working or understanding what it is that makes it. So back to my story about the person who doesn't know how to love, what happens that allows the neural network that allows the person to learn to love? Is there enough plasticity of the central nervous system to be able to activate those neural networks? And the answer is, I think there is. And I'll be showing you pictures later of areas of the brain that get activated and not activated in that situation. And so a lot of what I've been treating sexual addiction now for 30 some years. Pat Carnes and I had a unit together at one time, and working with that population, I always think that what I read in books is necessary but not sufficient, because I think what the person is oftentimes saying is, I don't really know how to love. I don't know how to bond. And you're doing is you're teaching the person to begin to fire up those neural networks to have the capacity. Because what happens is if you can't feel empathy for yourself and you can't feel empathy for other people, how can you love? And of course, if you're out screwing around, you're hurting the person you love, and you it means that you lack something in terms of empathy and compassion. So, basically what I'm saying is, what if it happens if you have a person who's a narcissist? I remember one time I treated a client for 2 years, once or twice a week, and I was leaving town. I was moving to from St. Louis out here to Monterey, and I was doing termination. And I remember I was feeling so much love for the client, and I was mourning, I was grieving, the loss of that relationship, and I was worried about him. And what was so interesting was that when I referred him to another therapist, he wasn't sad at all, and he bonded with that therapist like within 2 sessions. And I was sort of astounded, like, why aren't you more upset? And I realized that I thought we had a relationship, and it was an illusion on my part, because the client was of such a narcissistic personality style that he was a great charmer, and it made me feel like we were connected when we really weren't. And so I become much more sensitive to avoiding attachment. And I'm suggesting to you that there are a lot of people who have avoidant attachment. And when they get into a relationship, they look like they love their partners, and they look like they're in a committed relationship, but they're actually not. That there are too many defenses that keep them too separate to really have a proper bonding, and that relationship is at risk. So if I'm right, then the absolute necessity of marital therapy is helping whichever individual or both have avoidant attachment patterns begin to get more securely attached. And so I think what we're talking about is intrapsychic work rather than interpsychic work. Interpsychic work means between two people. That's the stuff that Gottman and Jacobson and others did. That's necessary but not sufficient, because if a person hates themselves in some deep sort of way, they're not going to be available to be loved by another individual. And so, what do you do when you have a person who hates themselves, has avoidant attachment, and when their partner tries to love them, they don't allow that to get in? They reflect it back and are disconnected in some way. And that's what this talks about. Okay, so that's my introduction. And I think now you can get this idea. I'm going to talk to you about how you seed the capacity to love. I'm going to talk about what happens with couples when one person has avoidant attachment. I'm going to talk about not just telling people why they do what they do, but actually changing their capacity to connect to another human being, which then is the key to, spiritual development in some ways. Okay, next slide. All right, so where I start with is that if in the basic model of differentiation, and we're going back to systemic therapy, if you have two individuals who are well differentiated, they get together, they're able to hold on to themselves and have some autonomy while being connected. And that's the definition of a healthy relationship. And so I want to just put meanings to that. Differentiation means that a person has feelings and thoughts, and that they're able to put them together in some way. That's reflective function. And that when they have difficulty separating from their family's feelings, and they're imposing their religion, their parents, and so on, it gets in the way. One of my clients said yesterday, I'm dating somebody, but I'm really scared. And I said, tell me more. And he said, well, I still get, afraid that, they might leave me if I get really tied into them. I tend to have anxious attachment and bond really quickly. And I say, uh-huh. And I can hear my mother's voice saying that she's not right for you. Every girl I ever dated, my mother was commenting on that this person wasn't right for me in some way. And I think that that was really powerful, because he could hear his mother's voice coming in as he was meeting this new person. And if you think about the whole process, that what would have been optimal was if the mother knew who he was dating at the time and was able to talk to him about that experience and what he was learning and discovering about himself, rather than coming in and telling him what he should or shouldn't do. And I think what we do is we introject those voices inside our head, and that they then get in the way because we're kind of channeling what our church said, what our parents say, what our culture say, what our friends teased us when they said, and we incorporate that in to our mind, and all that then feeds into our fears of intimacy in a variety of ways. So the experience of autonomy is really important. I got married when I was 38. And I said to myself, I don't think I was ready a day before that to get into a relationship. I had too much crap I had to work out from my family of origin. And I think when I was 38, I really felt inside open. I felt ready to connect. I felt that some of my own narcissistic kinds of tendencies had sort of moved to the side, and I was really much more capable of loving. I think what happens with a lot of people is that they get into relationships and they are not well differentiated. And so they form a relationship that's fused, where they're two halves of one whole, bind their romantic love kind of thing. And then they get together like that and terrify the hell out of themselves because they lose themselves in relationship in some ways. So the question is, when a couple comes in, how can you help each individual differentiate while in relationship? And that's what we want to be talking about today. Okay. Another book that I've been influenced by recently is a Arno Gruen book called The Betrayal of Self. And I love this book too. And what he says is that human development can follow one of two paths, that of love and that of power. Now think about that for a minute. If you get into a marriage or a committed relationship, you can be going down the path of love or that of power, control. The way of power in most cultures is domination. You control. This is a fragmented, split self that rejects suffering and helplessness as signs of weakness and emphasizes power and control as a way of denying helplessness. So a lot of people who get into this fused relationship then feel like they have to dominate and control their partner, because they're otherwise, if they don't cut off their wings, they're liable to leave them. So all of us are afraid of abandonment, and we're afraid of fusion. So what we do is we glub onto the other, and then we pull ourselves away, usually by power and control. Number D, in contrast to having access to life-affirming emotions of joy, sorrow, and pain. And so what we're trying to do is use the relationship as a vehicle to wake the person up to be truly alive. And what that represents is what Masterson used to call the development of the real self. I don't know if you know, I like turning you on to stuff. One of my favorite books of all times is In Search of the Real Self by Masterson. And in it, he takes that basic theory of understanding the borderline and is able to say, how do you see the development of the real self? So what happens, if you think about it, is, let's put it in dissociative theory, that part of dissociative theory of structural dissociation is that there are neural connections, and what happens is that a person, one side of the brain is operating under thoughts, another part of the brain is operated under feelings, and then as you reach the age of about 20, there's enough neural networks between them that you can think about what you're feeling and feeling about what you're thinking. But for some people, those neural networks don't develop. And so with dissociation, usually caused by trauma, what happens is that the person becomes obsessive compulsive and is thinking all the time, but not feeling, or the person becomes, highly hysterical and is feeling without thinking. And so part of what therapy is about is, what Dan Siegel calls linkages. And with linkages, what you're trying to be able to do is integrate the thoughts and feelings so the person can have the ability to know their own mind and know the mind of others. And that's called mentalization. So knowing when your own mind and knowing the mind of others allows you to be able to form a secure attachment. And so when you get into a relationship, and you're feeling a certain feeling, you're able to think about those feelings and not just sort of react. Now, what good marital therapy is, the Dan Wiley stuff, is that you're basically taking a couple who are fighting about an issue, like I hate it that he leaves jelly on the counter in the kitchen. And you're using that as a vehicle to help them understand their own mind and where that comes from, that I don't like jelly on the kitchen and the kit and so on. And then, tormenting the other, when the kids leave jelly, and to begin, instead of, learning how to fight, learning how to be able to begin to use that as a vehicle to be able to say, okay, when I see jelly in the kitchen, it makes me feel really anxious. And I think it's related to when I was growing up, my house was totally a mess. My parents were hoarding and there was chaos everywhere. And there was never any order. And I felt scared all the time. And so I think what happens is that when I see the jelly in the counter in the kitchen, I begin to feel all those feelings again. And I feel crazy. And your partner says, wow, you know, I thought it was about my housekeeping. I didn't realize that it had such depth to it. What can I do to help? And you see that what happens is that there's empathy between them. And then the other person has their own story, that my parents were crazy. They, every time we left a glass, they would scream at us. And so I think I'm freak out whenever, you yell at me in that way. So what you're doing in really good marital therapy is you're using the jelly in the kitchen as a vehicle to begin to teach the person how to be able to know themselves better and to know their partner better and have empathy between them in some way. And it's really cool when you do that kind of therapy. I mean, I love Dan Wiley's style. And what I'm doing is I'm taking it and I'm putting it into a much more depth understanding of dissociative features and using the dissociative nature of the mind to be able to help the person begin to look at the difficulties in knowing themselves and knowing others. Now, I want to just then emphasize people who are interested in power and control are very different than people who are interested in love. And I oftentimes, start with a spiritual kind of awakening and ask the person, what is important to them? Like when they die, how will they know they've lived? And will they think about all the wrenches they did at work 10 hours a day? Or were they thinking about the love they have for their children and for the people in their life that they have been in committed relationships with and their friends? And most of us realize that what we do is that our connections with other people are what's most important, and that our regrets as we get older is that we haven't allowed us to put the time and the energy into maintaining those relationships at a high level. And so I don't want to just give people caring days and teach them what their love language is and all that jazz. What I want to be able to do is I want the person to want to be able to give a gift to their partner every day, because they realize that what they give, they get. And every time that they put something in the relationship, they get back with interest, meaning that loving somebody is not just for the other, but it's for self. And the more you're able to build love, the more you reap the benefits. And you do it because it feels so good to have that loving relationship rather than feeling like, the control mode, which is, I'm going to do 3 caring days a week in order to be able to make my partner blah, 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 blah. You see the point? It has something to do with changing the internal spiritual base of love, and to have your life devoted to love and connection rather than control and power. Okay, now, as many of you know, part of my training was in Mary Main's work in disorganized attachment. And Lori and I took the training for the adult attachment interview, 10 days of grueling work. And honestly, it changed everything about how I think about things. The adult attachment interview was amazingly powerful in changing the lens by which I see things. And what you learn in that training is that the key to mental health is in this term coherence. Now, coherence means that you can begin to put the jelly on the counter in the kitchen into a much wider context and understand what's going on, why it's happening, and how it has power over you. And you begin to use that to begin to develop some autonomy and differentiation and decide, do you want to live in that kind of torment when you have young children who are constantly messing things up and making yourself miserable? And you can think freshly about these situations rather than being controlled by your past. Now, that means coherence. Coherence is understanding a little bit about your past, your present, and your future, and sort of being able to put the pieces of the puzzle together. And in it, there is what we call meaning making. Meaning making is really that phase of trauma where you can make kind of meaning out of suffering. That Viktor Frankl logotherapy stuff, where a person who can use their trauma in a resilient kind of way to help understand more about the world around them allows them to be able to grow. So, I think that maybe the suffering that I've experienced in my life has given me wisdom. I remember when I got divorced, I I felt kind of ashamed because I thought I'm a marital therapist and I got divorced. What if people find out? Like don't spread it around. And then I thought about it for a while and I thought, I've learned more about my emotions in this divorce than every book in my library. And I have suffered so much pain that I get it in a way that I could never have got it before. And I became like a 10 times better couples therapist because I knew what did work, what didn't work, and I knew what I had done to sabotage, and I knew how my avoidant attachment operated, and I knew that at a cognitive level and an affective level, because I had suffered so, what my client was experiencing. So typically I'd be seeing men who were getting divorced and they'd come in and they would just be falling apart, wanting to die. And I didn't get so all cognitive behavioral with them. I was able to join them in their affect because I had known that kind of suffering myself and was able to mirror there in some ways. And so by beginning to mirror in a tuned sort of way what they might be feeling allowed me to be a much, much better therapist. So I think the point I'm getting to is that shame is the root of all evil, and knowing that my own shame and being able to look at it objectively allowed me to begin to benefit from that experience in some ways. And honestly, I think that when I talk about seeding love and building those neural networks, for some people it begins in the therapeutic relationship. And they may be having avoidant attachment, but if I'm able to show that I get them and able to mirror that back in a compassionate, empathetic way, in a tuned way, I can begin to seed what wasn't seeded there as a child. And so finally, there's somebody that gets them and that they're not all alone. Now, in a marital relationship, that can be good or bad, because I used to think that when I was seeing an individual alone, I was like a vampire. I was stealing from them all that intimacy, and they were building an intimate relationship with me at the cost of their marital relationship. So I changed my model of working with them couples, which is I stopped seeing individuals alone. I would see individuals if they were in a relationship with their partner. And so what would happen is I would see the individual, I would do depth therapy. Their partner would be sitting on the couch next to them. And then I would encourage them to spend an hour after the session going out and having coffee with their partner and talking about what that experience was like for them and what they learned and what they felt. And so they could integrate what their internal experiences were into the relationship. And so the client had two mirrors. There was me who was mirroring and the partner who was mirroring. And the partner could see what it was like in a modeling way to have someone who had a secure attachment and was beginning to be compassionate in their modeling in some way. And instead of giving advice, instead of telling them what they should do, instead of trying to fix it, instead of telling them what they should think, that they could see what an attuned partner is able to do. So think about all I was doing. I was showing the client what it was like to have somebody who was attuned, repairing some of the damage from their family of origin. And I was teaching the partner how to be able to be there and be connected to and support. And of course, what makes trauma traumatic is you're all alone. And so when you're working through post-traumatic stress, the fact that you have the therapist along with you and you have yourself along with you, your real self, allows you not to feel so alone, particularly for those injured parts. And now you have your partner there with you. So there's the injured part has three individuals with them. They have the therapist, they have the self of the individual, and they have the marital partner. And so they're getting 300% of the repair rather than 100% of the repair. I hope that makes sense. I'll try to say it one time more succinctly. When I'm working with an individual, I oftentimes will ask that their partner be in the room. And as I do depth therapy with the individual, I then am trying to provide a person who sees them and knows them, which is me, and allows them to be with their adult self, who's then reparenting them and beginning to tell the individual what they needed to hear back then. So instead of saying, you're a dumb shit, how can you be so stupid? The self is saying, I understand. I understand how you feel, and I love you and I care about you, and I'm so sorry that was done to you. So they have the self of the individual, they have me. Now they have their partner who has the ability to be able to mirror this in some ways. It's so powerful when you're able to do that. So here's what I do. A couple comes in for marital therapy. I may do some Dan Wiley kind of stuff. And then when we hit a stuck point, I start working with the individual and doing depth work with them with their partner in the room. Then oftentimes their partner gets activated and I'll do depth therapy with her, with their partner in the room. So I'm oftentimes doing couples work with both, or then he becomes the client, then she becomes the client. And I'm working with him, her, and them. And in my mind, I'm always thinking there's three clients here. There's him, her, and there's them. And sometimes when I do the Dan Wiley, I'm working with them. Sometimes when I'm working with him, I'm doing intrapsychic work. And sometimes when I'm working with her, I'm doing intrapsychic work. That takes a lot of energy. So I actually prefer to do this in co-therapy. It's hard in private practice because it's so expensive. But in this kind of a model, we can afford to do that. And I really like doing co-therapy because, she's working with her, I'm working with him, when both of us are working on the relationship. And so whenever possible, I bring the co-therapy model in, particularly if you have people who are in training. It really helps to be able to train them and to be able to take some of the load off you. All right, next slide. Now, as I said to you, part of my thinking comes from working with disorganized attachment. And in our trauma program, I would say most of the individuals have disorganized attachment, and we're moving them towards earned secure attachment. If you want to learn more about this, you can look on our website, and I have lectures on that. But I want to go to this quote a little bit because I picked this up recently, and with disorganized infants, we're talking about misattunement. And it says, and I just want to go to this line about 4 or 5 sentences down. These mothers are unable to allow themselves to be emotionally affected by their infant's dysregulated state. Thus, they shut down emotionally, closing their faces, looking away from their infant's face, and failing to coordinate with the infant's emotional state. I really find myself tuned into those words, because if you watch the still face and you watch the kind of misattuned families, what happens is that you can see the child becoming sympathetically aroused in the disengagement. And specifically, what predicted disorganized attachment was, this is cool, not being sensed and known by the mother, and a confusion in sensing and knowing himself. Aren't those powerful words? And what is a therapist? A therapist is someone who's attuned, who allows themselves to be sensed and knowing and mirrors, and they're faced in some ways. So if you have a therapist who's disengaged and misattuned, you know, and very cognitive behavioral, and that's the way all of us have been trained, it can really kind of result in a misattunement in some ways. I always thought that my training as a cognitive behavioral therapist created misattunement because I was always thinking in my head of what the right intervention was. What is a evidence-based treatment? When a person says they're suicidal, what am I supposed to say that's effective? What am I supposed to say that's destructive? And so I became so kind of cognitively oriented toward doing the right thing that I lost my natural capacity as a healer to be able to be with the other person and connect to them while they're going through that experience. And so as I got more aged as a therapist, I realized that most of my training actually hurt me rather than help me. And so what I had to do was take my psychologist self and get it to step back and bring Mark back in the room and allow myself to be attuned to the client with proper boundaries, meaning that I wasn't, their pain was not my pain, but I could feel their pain and not get lost in it in the way they were lost in it. So I was able to bring my healing self in and not combine it together with bad boundaries and somehow want to save the person or take care of them in some ways, but instead just be caring rather than caretaking. So that's pretty sophisticated. And I don't think anything in my training prepared me to do that. I think some of the newer programs are much better at that. But in my days, being a psychologist meant being a scientist. And it was trained into you that this is an empirical science. And your job is not to be a healer, but your job is to be a technician. And of course, I think that's bad therapy. Next slide. I hope I'm not offending anybody. I'm sure I am. Okay. Now, the problem with avoidant attachment is that the child takes information inconsistent and they put it into unconsciousness. So the child keeps a favorable view of their parents while knowledge of the bad or disappointing aspects are excluded. So the person comes in and says, I know my mother loved me, even though she beat the shit out of me, but she didn't know how to show it. And it was hard for her because I was always in trouble. Now, this is a really brilliant statement. And that if you just look at this statement, I know my mother loved me. She didn't know how to show it. So you let the mother off the hook, which means that you feel like you're that bad one. It was hard for her because I was always in trouble. You're a bad kid, and she was a good mom. Now, this is the heart of disorganized attachment. What Dan Siegel says is that, the disorganized client comes in and says, my dad and I had a very loving relationship, and he showed me how to play the flute twice a week. Well, showing you how to play the flute twice a week is not a loving relationship. It means that your dad helped you be proficient with music, but that's not a loving relationship. So the person has no frame of reference of a loving relationship. Love is instrumental, not affective. Love is an affective experience. It seeds the neural networks of love. If the right side of the brain is operating under affect and the left side is under cognition, you're overdeveloping the cognitive part at the expense of not developing the affective stuff. So love is an affective experience, and you're loved because the person, you know, is able to know your feelings and mirror them in some depth kind of way. And so what has to happen with this statement is you have to be able to work it with the client and begin to help them look at this as a form of idealization, we call it in measuring the adult attachment interview. And idealization is probably the number one block to secure attachment. Well, what's the opposite of idealization? Not thinking that your mom was evil or bad, but begin to understand the mind of the mother in a more significant kind of way. And it might be a stage where you get angry at the mother for the things that she did or didn't do, but it's just a stage that you eventually move through, because hating somebody is actually more detrimental than anything. And so you let go of that hate and that anger as you begin to recognize that we're all human beings and imperfect and we make mistakes, and we get rid of that perfectionistic kind of set and begin to, join the human race. Every day I make mistakes, and I love the fact that I can learn from those mistakes, even though I hate the mistakes. So that's kind of an ideology that you're continually impressing upon the person. So if you have a couple and one person is idealizing their parent, then you can bet that there's going to be disorganized attachment, and that what's going to go on between the couple, now this is a key thing, is they're doing projective identification, and they're taking all the, my mom was perfect and I'm bad, and they're projecting into the relationship. One of the problems of marriages is you have two conclusions: I'm bad or my partner's bad. So every fight comes in, and the person is either blaming themselves or blaming their partner. And that's the result of disorganized attachment. Because if you have worked through this thing about mom being a bastard and treating me cruelly in a proper sort of way, then you don't have to project your anger towards your mother onto your partner. And you're able then to be able to see the residue of what happened to you by idealizing your parent. And so when you get into a fight, fights actually have the potential to grow a relationship. If you have a couple who are not fighting, you do not have a well differentiated marriage. And so what you're trying to be able to do is encourage them how conflict in the relationship can cause the relationship to grow to the next step in their own evolution. And that's the purpose of marital therapy. Marital therapy is so cool, because you take the fight, and then what Wiley says, you turn it into a conversation. I love that. You take the fight and you turn it into a conversation. But you have to show them how to be able to do that, and how to use the fight as a window into understanding something about themselves and their past. And so a fight means that you're probably not well differentiated, and that you have not developed autonomy sufficient, because you expect your partner to do things the way you do it. Why don't you load the dishwasher the right way? Why don't you ever wash the clothes? Why don't you ever pick up your own laundry? All those are signs of a poorly differentiated individual in a fused relationship. And both partners contribute. So in every marriage, there's a 200% contribution. And each of the partners that are, sometimes you get people who are avoidant, you get together with somebody who's anxious. Sometimes you get someone who's disorganized with someone who's with avoidant. But rarely do you get two securely attached individuals coming into a couples therapy. And if you do, it's like you bless the world, because it's such a relief to work with that couple. But what you're working with is the disorganized and the anxious styles, and both of them cause the individuals to get disconnected in some way, and you're repairing the individual's attachment style, which allows them to be able to have intimacy together. Maybe the problem is what we call love. My parents loved me, my mother loved me, my husband loves me, I love them. And we throw it around like a ping pong ball. And most of us really don't know what love is, because love is an affect, and love is something we grow at. So I looked it up under Google. Why else can you figure out what love is? And these are some of the definitions in Google about love. But what is love? And how do you know if you're capable of loving? When the client says, I don't think I love, what the hell are they really saying? Love is an affect. Love is the genuine ability to feel connection. Love is the ability to care about another individual, the depth of your caring for another individual. Love is when you miss the individual when they're not with you. And love is when you're with them, you feel safe and connected and less alone. But that's what love is, and that's what love isn't. So we're always working with love. Now, I'm still a psychologist, so I got to go back to fMRI scans, of course. And this is an fMRI scan, and what you see is romantic love is really different than maternal love. If you look at that eye on your picture here, the eye is the insula. And when a person's feeling romantic love, the insula is activated. And a lot of people think that romantic love is energized in that insula, whereas maternal love is more the anterior cingulate. And you can see that lighting up the AC pattern. And so what does this tell me? I like having this kind of vision in my head, because when a person says, I don't think I love, I don't think he has the neural network in the insula that lights up. And of course, I've never done research on this, but I bet money on it. And so what eventually I want to be able to do is fire up those neural networks so that person has the experience of both maternal love and romantic love. And sometimes, by having a child and learning how to love your child, my guess is that it's more like romantic love in some ways, that you feel those affective feelings of adoration and love much more deeply. And I think some parents don't love their children. I think they take care of their children, anterior cingulate, but I don't think they really love their children, because if you can't love yourself and you can't love your partner, you probably don't love your children. So in my old days, one of the things I did is I did attachment therapy, and I would bring the parent in with the child in the playroom, usually the infant, and I'd work with them in the playroom. And what was so interesting was that they did the same thing with their children that they did with their wives. I work mostly with the husbands. And what they would do is they would try to control the child, and the way they tried to control their wives. And when I saw it with their children, it was like so apparent that, I could work with them in the playroom. And so if you're in that mode of control rather than love, you're going to try to control your children and think that you're a good parent because you control your children rather than really loving your children. So I think it's important that we work on this thing called love. And there's such a thing as anti-love, which is anti-love means you want to control people. Love means that you genuinely care about their well-being in some ways. And so misattuned parents are oftentimes misattuned spouses. And you'll see this a lot. So I'm really interested in their child rearing patterns and how they're raising their children. And I see that as a natural growth of how they can love each other. So loving yourself, loving your children, loving your partner, there's some overlap there. And I'd like to get the insula involved in all three. Now, what allows a person to be able to love is self-differentiation. And what that means in systemic language is that the person achieves emotional separation from their family of origin, but also from their multi-generational burdens. As a trauma therapist, I think I got over focused on PTSD, because most people's trauma is not PTSD alone. PTSD comes from a family where there is misattunement and lack of secure attachment. So what we eventually learned was that the attachment pattern set up the way the person responds to PTSD. And so it was like a numerator and a denominator. The PTSD was the numerator, but the denominator was the attachment environment in the first 5 years of life. And that attachment environment was oftentimes very much influenced by multi-generational burdens. So here in Monterey, I would say 3/4 of our clients come in first-generation immigrants, and they're carrying the burdens of their parents and their grandparents and many generations before them. And that they don't realize that it's in their unconscious. Just so many of the burdens of their parents that they're carrying on in some ways. So they have trauma, but you can only understand their trauma in the context of the intergenerational burdens that they're carrying. And so I like doing the family work. I like seeing them and bringing their parents in, because in it, you're able then to work through some of those multi-generational kinds of things that help the person separate and help the parents understand that when they love their children, they don't want them to be duplicates of themselves, but they want them to be able to become the next generation without the burdens that they carry in some ways. So one of the best ways I know of letting people differentiate is by doing family work. So, you can see that, there were times in our development as therapists where we're cognitive behavioral. There were times in our development that we became systemic. And now what I'm doing is I'm trying to combine all of that and leave all my training as a cognitive behavioral therapist, as a systemic therapist, and now as a trauma therapist, and combine those three models and use all the growth in the field to be able to help the person differentiate in a systemic way in order to have a healthy relationship. And Barry Bowen was the best at that. And so I don't really want you to read this, but he has this scale of differentiation that I oftentimes use in marital therapy. And it really helps you delineate what is differentiation, what's not. It helps the person begin to get a mirror to know themselves more accurately. You can look at this later. It's kind of a gift. It's online. It's just beautiful and it's so helpful. Okay. Now, Kathy Steele, who is another one of those people who I just love, I'm going to pull her book out because I love that book. It's called Treating Trauma-Related Dissociation, Practical Integral Approach. And, I wish I had written this book. Kathy Steele is so smart. It took me 20 years to learn what's in that book. And then she put everything I learned into a book, which is really, really cool. Now, what Kathy Steele then says is that we don't really have a self, like we have a brain or a heart. Our minds construct a continually evolving story of who we are. This is what we call self. And of course, Dan Siegel has championed this by talking about the mind different than the brain. Patients with dissociative disorders subjectively experience themselves and their personalities as fragmented and often as outside their voluntary control and awareness. So I always say in group, how many of you have felt out of control? And every hand goes up. And then I say, talk to me about a time when you were out of control. And they tell stories about being out of control. Being out of control is a window into unfinished aspects of self. And so I'm constantly curious when I have very strong emotions and feelings that are not like me. So there's like you and not like me. And for example, when I'm with my siblings, I have a brother and two sisters. And when we get together, I lose my voice. I just stop talking. And I sit there at dinner and I don't say a damn word. And so, my cognitive behavioral therapy, I write down, when you're at dinner, talk about this, as I write out 4 subjects that I'm going to talk about at dinner because I don't like that I'm that way. So I get to dinner, I pull out my cognitive behavioral 4 stories I want to read, speak a word. Now, what does that mean? It means that I lose myself when I'm with my siblings. It means I need therapy, because, there's something going on here in my unconscious. And if I'm wise, I take that and I use that as fodder for my next piece of work. And every time I do a piece of work like that, my capacity to be happy increases. I just wake up happy. And so what I've realized through my own introspection is that if I notice where I have stuck points from the past and do work around that, it opens up what we call self and enlarges it. And I have much greater capacity to love and care for both myself and others, which then makes me happy. So through introspection, that's what I try to do with my clients, is that when they lose themselves, they're out of control, that becomes a door into the next piece of work. Now, where does that trigger more than in a committed relationship? Have you ever gone on a coffee date if you're single and you find yourself, like putting a tape on and listening to what you say? It's so interesting because either, we get into our grandiose self and tell the other person how cool we are, or, we become really quiet or we become really anxious. But rarely can we just be ourselves in that kind of a situation because we're so anxious. And it's just a window if you look at it in some ways. how much do you like yourself? How much do you feel at peace with yourself? And of course, the more you like yourself, the less you have to broadcast it to everybody else. It'll just be apparent by your affect, not by your words. And so, when I'm working with single people who are lonely, I think what I'm doing a lot of work with is beginning to help differentiate the self. Okay, now this concept turns out to be really helpful because I would say that the vast majority of the couples that I see are fused. Fusion generally reaches its greatest intensity in marriage and the emotional closeness between two spouses, and that they partially fuse in some ways. And so you kind of get into, I know you love me if you pick up my laundry instrumentally. I know you love me if you iron my clothes. And so you somehow begin to develop a kind of a dependency on turning your wife into your mother, for example, or your husband into your father. Sometimes the degree of closeness is only tolerable if the spouses distance themselves from each other rather than operate as a combined self, having more autonomy. The intensity of this resulting fusion largely depends on the spouse's differentiation before marriage. So if you have two people who are well differentiated and they get into a relationship, they can maintain their autonomy. So what would I tell a couple who are getting ready to get into a relationship? I would tell them not to lose themselves. Have you ever had a friend who you're really close to, and then they get into a committed relationship and suddenly they disappear? They don't answer your phone calls, they don't answer your texts, and you feel like you've lost them in some way. Well, that's a tragedy because what you want in a relationship is that you can maintain those friendships at a high level and be in a relationship with your partner. So you're able to say, tonight I'm going out with my friends, we're going fishing next weekend. And the partner doesn't then say, well, you've got responsibilities at home. How can you do? You don't want to cut off, you want to celebrate your partner's autonomy. Now, let's say you're extremely jealous and you're afraid, there's some really pretty women at work. I don't like that you spend that time at work. What were you doing going out to lunch with? Well, that then begins to somehow keep the person from developing a friendship at work because they're always afraid that you're going to get jealous, and it interferes with their individuation in some way. Well, you say, well, what if, it isn't good? Maybe the partner is fooling around and maybe, seducing or romancing the person at work. Well, that's a sign that the marriage is in trouble because why would you do that when you love somebody? You don't. When you love somebody, you kind of do to them as you would want done to you. So you keep the boundaries with the people who are attractive to you, and you don't get seductive with them because you wouldn't want your partner doing that. So there's got to be some rules that people live by. So autonomy is not something that is easily understood. And so if I'm working with a couple where there's jealousy or there's trying to control the other, oftentimes means that the partner has really poor boundaries and is really unable to healthily love. And that then creates jealousy. So jealousy is not between them. It has something to do with each of the individuals and their attempt to control the other, probably for some damn good reason. You get this a lot when you're dealing with sex addicts. It's like, okay, you stopped acting out, but do you really love me? And how do I know that you won't act out? And I've worked with a lot of couples where there's been sexual addiction, and the partner will say, how do I know I can trust the other person? Now, how do you answer that question? I know how to answer it, which is you know it because the quality of your love relationship changes. The person genuinely gets you. They genuinely feel your pain. When you go to the hospital, does the person say, I've got to go to work? I'll see you when you come home? Or does the person say, oh my God, hospitals are scary places. I am going to be by your side every step along the way. I'm not going to let you be alone. Hell with work. That's love. But if a person's of the other persuasion, which is control success, then they're going to be able to say, listen, I've got to work. I'm sorry I can't be with you. You have to do it alone. Well, you have a crappy relationship then. So how do you know somebody loves you? It's so apparent because their caring is of a whole different sense. And so when I'm working with couples with sex addiction, it's not just sobriety that I'm looking for. I want to see the development of the real self, and I want to help them have true empathy and compassion for themselves and others. And that's not written in the sexual addiction books, nor is it talked about how you do that in some ways. And it's more what we're talking about today. So the most helpful thing, I don't know if you've read Liotti's work. He's from Italy, and Liotti is like a genius. And Dan Brown went to Italy and met with him and brought back all of his papers for me. And I've read all of Liotti's stuff, and I just love his writings. And what he says is that early dyadic processes lead to a primary breakdown or lack of integration in the coherent sense of self, unintegrated internal working models. So part of self is dependent and needy. Another part of self uses avoidance strategies. So the typical person with disorganized attachment is that they have elements of the anxious attachment style and elements of the avoidant attachment style. So what happens is, I don't need anybody. I'm going to go live in the woods by myself. People suck. And then they go off and they're so lonely that the next person who comes by them that wags their tail, they jump on, and then they get into an incredibly destructive relationship which sends them back. So they binge and then they restrict. They binge and then they restrict. Now, what do we call that? We call that addiction. So there's such a thing as love addiction. And love addiction is just another form of addiction. It's the same goddamn thing. So you can you be alcoholic, and then you go into a sex addiction, then you go into a love addiction. And what people do is they substitute addictions for each other. So addiction doesn't mean sobriety. Sobriety is not the cure for addiction. Sobriety is the first step in dealing with addiction. But one has to deal with the addictive personality, which means that person has a hole in the middle of their stomach that can never fill. They feel alone when they're with people, and they're empty and they're hollow. That's the addictive personality. What's the cure for the addictive personality? It's integration and linkages. The addictive personality is real, and it means that in the mind and in the brain, there are not linkages between the right hemisphere and the left hemisphere in an integrative kind of way. So the person is able to use their emotions as signal states for action and use people as a form of affect regulation. And if people have hurt you, they're not going to be a source of affect regulation. So one has to deal with the fact that they're afraid of people in forming close relationships because of disorganized attachment. The people who love them hurt them so badly. And they've repeated that over and over and over again in a reenactment repetition kind of thing. And so they're just recreating Groundhog Day with their disorganized attachment of binging and restricting, that then they form relationships. So, most men who divorce get remarried, within a couple of years quickly, and they do the next damn thing relationship the same way. So divorce is always a time when it's time for you to look at your attachment patterns and look deeply at what you did and do an autopsy on your own contribution, not with fault finding or blame, but more with wisdom and clarity and learning about yourself and what you do in relationship that causes you to go from this to this to this to this and form a more earned secure attachment. When you do that, your partner you pick is going to be constructive. What is the best way of dealing with disorganized attachment? Answer: find a partner who's securely attached. But when you do, you're going to be scared to death. And you're going to then think of yourself as defective and bad. So shame is the root of all evil. So what one has to do is form a secure attachment and stay with it rather than running away. So what I try to do is teach people what their avoidant patterns are to recognize them. So then when they get scared, they can be in their body and feel scared and not run away, but run towards. Avoidance is not avoiding intimacy with other people. It also means that you are avoiding a relationship with yourself. avoidant attachment is avoidance of self and avoidance of others. It means that you're a talking head, that you have no connection to your visceral, that your affect is numb, that your affect regulation is cut off, and that whatever is happening in the brain, there is not the neural networks to feel about thinking and thinking about your feeling, which, so I think what happens is that people get arrested at about 16 to 18 years of age. And a lot of couples, they act like adolescents. Sometimes they act like children. They kind of regress. Bruce Perry talks about under stress, you regress back to an earlier period, and that part then takes over. And I think that's probably true. I think, when couples come in, usually on their first and second appointments, they look a lot like either children or adolescents fighting with each other. And, if they can step away from their arguments and fighting, it's almost, they can look at themselves and see how silly and regressed and primitive they really are. And so what we're trying to be able to do is help them begin to look at their avoidance patterns. By the way, this Linda Curdy reference is a really good one. And since I'm showing you books, this is called Attachment and Defense Against Intimacy. And I would buy this book. It's so good. And what it's edited, and there's a number of authors in here, but each of them says this great stuff, but it's come from Britain. And it's just a really good book on understanding relationships and attachment. Okay, so the avoidant person's need for distance from partner is linked from distance from self. So they have low receptivity, they have disinterest, they're very defensive. So what we're talking about here, just so what I say the obvious, is that people have defenses that they set up that keep them from getting close. And we're not talking about disorganized people, we're talking about all people. All people have fears of fusion and fears of abandonment. It's a natural part of the human condition. And most of us have to get to a point of beginning to like ourselves sufficiently that we can tolerate the pushes and the pulls between those two patterns. So this applies to all couples, not just the ones that are dysfunctional because of their early attachment patterns. But most of the securely attached people are living happily ever after. So if you're lucky enough to have that kind of relationship, you probably have done a lot of your own repair and don't need a whole lot of therapy. So what happens oftentimes for therapists is that we're getting the ones with the less organized pattern. And the kind of caregiving is more mechanical. That piece is really important, which is they take care of their kids and their kids feel like they're loved because they're taken care of, but it's a mechanical kind of taking care of. One of my clients said, I get up at 5 in the morning and I do my spinning, and then I get my kids ready for lunch, and then I do the next thing, I do the next thing, I do the next thing. But I don't know if I really love my children. I just do what's necessary. I feel sometimes like a ball inside of a pinball machine, going from one thing to another thing to another thing. And everything is really mechanical, and I do all the right things, but there's no connection to I don't enjoy it. I just do it because I have to do it. And you can feel it when you're with a family where the parents genuinely love their children. And it's a much more exchange of affect than it is that mechanical stuff. And so, when we're talking about intimacy, as I said earlier, oftentimes you can look at intimacy by looking at that mechanical nature of the caregiving versus more of an affective interchange. And that's why I like that slide showing that the caretaking part of love is one part of the brain, and the insula part of the brain is another part. And I think we're trying to sort of build that neural network in what we do in therapy. So what are these deactivating defenses for avoidance? One of them is focusing on your own imperfections. Perfectionism is the root of all evil, and it is a form of self-hatred. Flirting with ex-girlfriends, keeping secrets, overdosing self-reliance, ignoring your partner's needs, overvaluing your independence, denying that you have any needs. That's the classic avoidant pattern. sexual inhibition. All these are avoidance strategies. And what therapists have done is they get too focused on the symptom without yet looking at the symptom is really a window into the avoidance strategy. So most of these are unconscious. And there is this thing called the unconscious. And the unconscious is all that stuff that gets formulated in your family of origin, which you're not aware of. And it influences how you think and feel and act. So the goal of all psychotherapy, Carl Menninger, is to bring that which is unconscious into consciousness. And so learning your avoidance strategies and looking under them and asking yourself, what's this about? Why do you feel like you do this? And not just stopping the behavior, but really understanding its origins allows you to be able to begin to be differentiated. And so studying the unconscious need for avoidance is always the door into autonomy and differentiation. The value of a psychotherapist is to listen to the unconscious, to be attuned to it, and hear it in the words the person's using or the actions or the feelings or lack of feelings, and to be able to be attuned to that with your third ear. And that, kind of is a much more affect-based therapy. So Diana Fosha and her affect accelerated psychotherapy, Richard, well, Dick Schwartz, in these affect-based therapies that are much more attuned to listening with your third ear and sensing what is not being said, allows you to be able to be much more aware of these avoidance strategies. I had a couple come in last week, and the wife had borderline personality and was really acting out in really destructive ways, including some physical violence. And so I was working with the wife on a lot of her behavior, and she screamed at me. She said, you don't get it. He drives me crazy with his avoidance patterns. I didn't use that word, but with some of the things he does. And she was right that I could only understand her out of control behavior by understanding something about the things that he does that drives her nuts. And they're much more subtle because he looks perfect on the outside. A lot of his behavior are avoidance strategies. So I listened to her and I said, you're right. You're right. I'm over focusing on your acting out, and I'm not really getting what's going on between the two of you adequately. And so by not knowing what the avoidant patterns are, because usually the avoidant gets together with someone who's disorganized. That's the classic marital pattern we get. And so we deal with the disorganized pattern because it's so out of control and destructive, but we miss that it's the avoidant pattern that kind of fuels that disorganized. And so if you don't deal with both, giving equal attention, you're going to miss it in some way. Anyway, this is, this is the biggest mistake marital therapists make, is they try to get on one person in the relationship who's acting out and not understand that the dynamics that goes on between both. All right, so Holmes has commented that avoiding the individual might possibly form a bond with someone who's disorganized. And that's just what I just said. And the chaotic, uncontained partner will be carrying the intense feelings that the avoidant person most fears. So there's projective identification, which is, I am very mechanical. So when I go to funerals, I don't cry. So I find a partner who cries at funerals, and we are complementing one another. So, she wants to be like him and be more cognitive when she grows up. He wants to be more like her and be more active when he grows up. Well, that's a bad deal, because if she wants to become more cognitive, she's going to become less healthy. So women who get into the power control mode and enter the man's world don't realize that actually they're becoming more dysfunctional. They're taking on all men's worst habits, power and control. And the woman's pattern of focusing on love and emotions um, allows the man to be able to grow and become more differentiated. Now, I think that's unfortunate and it's sexist and it isn't fair, but it's true nonetheless. And so if a person who's into power and control is able to find a securely attached partner who's capable of loving, eventually it may fire up his neural insula and allow him to be able to become more capable. So I think that finding a securely attached partner is actually even more valuable than finding a really good therapist in allowing you to heal this. But I think both are better than either. And often a really good therapist allows you to be able to bring that out in your partner. Okay. So, people always say, well, what the hell do I do in therapy? And then, how do I take these conceptual components and be able to work with them? And, I'm a big lover, as I said to you, of Dan Wiley. And I, Gottman, um, in his marriage clinic book, he talks about sort of the doing a Dan Wiley is one of his chapters. And that's what I do. I do a Dan Wiley, which is typically in couples therapy, I let them argue and fight or communicate. And of course, I give them all the skills of I language and self responsibility and all the cognitive stuff and have them practice it and give them caring days from Richard Stewart. I teach them love languages. I teach them how to be able to be in relationship. And that's kind of like dealing with the symptom. It's the first stage of therapy, but it's not really marital therapy. It's more like going to school and teaching them how to be in a relationship. And they like that, and the relationship gets better, but it doesn't last. So the second step then is I move more towards a Hendricks model. And this is another one of my favorite books, Receiving Love. And what the Hendricks talk about is when somebody loves, but the other person is not able to receive it, they reflect it back because they have avoidant attachment. And, they're really good at being able to recognize this. And that they use the imago term. And the imago term is really an interesting kind of thing, which is it's what the person carries from their family of origin in the original bonding environment that carries into the marital relationship. So, basically they're saying the same thing I'm saying in a different language, and I'm saying what they're saying in my language. But the imago incorporates a lot of that, and it's just great. And I usually give that as a self-help book for people. But reading this stuff doesn't translate into changing their relationship. You can't read about secure attachment and become securely attached. And so the important thing is being able to take that reading and transform it into marital therapy. So they can't do that without the help of a coach. So really what you're doing is coaching, and it's different than the depth therapy. Coaching when you're working with a couple means that you're taking their adversarial cycles and you speak for them. So why they call that doubling. So what he does is he gets down on his knees and he doubles. What I'm saying to you is, and he'll reframe the message into a communication that goes deeply into affect rather than just, and it would go something like this. I'm really scared and anxious when I see the kids getting bad grades in school, and I feel like a really inadequate parent. Second step, looking at where that comes from. I think that this fear of the kids not doing well comes from the fact that my parents were so oriented towards grades and success and happiness is the amount of money you make, that I have a hard time getting that out of my mind. And so even though I want to be able to know that our daughter is an artist and she may not do well in algebra, my parents' voice just keeps coming into my mind. Well, if you double for the client and you then do, then the client looks at you and said, how did you know that? Well, if you've done a really good history, you know your client and you know something about their family of origin. So you can help them make connection between the present and the past. And in that, there's such positivity because, I love my children and I'm conflicted inside, and this is the way it comes out, becomes transmitted in some ways. So when you do that, it helps the person know their own mind and knows their own thoughts and feelings. And they're using the conflict as a way of being able to do that. So we go back and forth between that. And usually at the end of the session, the couple feels so much closer, and they actually feel closer to me because finally somebody gets me and understands my mind. So if you think about reflective function, what I'm doing is I'm helping them know their own mind and helping them get to know their partner's mind and their motives and desires and so on. Now, so much of what Gottman does is the same stuff in a cognitive behavioral way, because by having them do all those uh, worksheets when they go home, it allows them to do a similar kind of thing in a cognitive behavioral way. So I like doing it in a session, and then I like giving the Gottman stuff on top of that to be able to put 2 or 3 hours in between the session, because these are bad habits. And by practicing those in some ways. So you see, what I'm trying to do is I'm taking all the pieces of what I've learned along the way and I'm integrating them in some ways. But as I've said to you, that sometimes I'm working with a relationship, sometimes I'm working with him and her. And what a lot of the Gottman trained people do is they don't really get dissociation and disconnected parts of self. And until you can help the person integrate individually, they're not going to be able to be in a healthy relationship. Now, avoidant people can hyperactivate their sexual system to activate the need for attachment. And this is such a incredibly articulate statement. Some use sex to get external validation of lovability. In our program, I would say at least half of the women are sex addicts, but they haven't come in here for sex addiction. They've come in here for eating disorder, or they've come in here for alcohol, or they've come in here for depression. But when you get them in the room, and I have a sexual addiction group each week, and they all come to it, and then they begin to disclose things that I would never have other known, which is this, that they either get turned off to sex with their partners that they love, or they get turned on to sex with partners that they don't love, and they don't understand why. And it's such a shameful, complex thing. It kind of seeds a lot of destructive internal states. So what we have to understand is, as I recall, basically I was trained by Masters and Johnson for 15 years. So I know how to do sex therapy. But I think what we missed was that a sexual relationship is only a manifestation of the attachment capacity. And you can't rip sex out of intimacy. Sex is basically an extension of intimacy and an extension of your capacity to love. So a lot of couples, they're fucking each other, but they're not really making love. And we use those words like cliches, but making love means that you genuinely have the capacity to care deeply about the person you're making love with. And when you look into their eyes, you feel this connection and safety and adoration, which is deep and systemic. It's an affect. And if you can't do that, then you're going to fuck them. And you're going to need more and more of this and this and this and this in order to get aroused, because you're avoiding the capacity to have real connection. Now, of the tools that I've learned how to use, one of the ones that I've started picking up lately is Dan Brown's work. Those of you who know Dan Brown, he wrote this incredible book called Attachment Disturbances in Adults. And in it, he sets this paradigm of the three pillars. And one of those pillars is what he calls the ideal parent. And most of us haven't been trained in it, but Elliot is doing more training online on the ideal parent. And I took a little bit of that training and I realized how powerful it is, because what Dan Brown and David Elliott were realizing is that some people do not have the mind to be able to feel love because it wasn't blueprinted in their early environment. And so the ideal parent begins to build a template inside the brain that was not there before of someone who loves you as a child. Now, Dan Brown then took it to the next step, and David Elliott is now doing that since Dan's death. And what he does is he begins to do an imaging of the partner in a romantic relationship. So in that, you begin to form a new self. The ideal intimacy template, imagine sometime in the future when you found just the right intimate relationship. So basically, this is trance work. You allow the person to go into a deep trance. And in that trance, you begin to implant a template of imagine a day-to-day life with a secure, intimate relationship. And then you fix it in the vision of your mind. And Dan gives you a template in the Attachment Disturbances in Adulthood book of how you begin to do the trance work to implant this in some ways. I do this with sex addiction almost constantly because I think people can talk about what they're feeling, but they're not feeling it. They don't really have a template. And so this ideal intimacy template, I think is Dan was, he worked with in what hypno imago kinds of techniques. And in these hypno techniques, he was a brilliant hypnotist at one time. And he would begin to implant sort of a template in the mind. And since the mind doesn't exist, but the mind is something that's created, he would create a template that was not put in there in childhood in the adult. And so I realized that some people just don't have the template. You can't imagine being happy, much less to be intimate. And so if you can begin to implant a template of what it would be like to be happy and can have a template of what it would like to have intimacy, then they can create it. But if you don't have a template, it's probably impossible to create it in some ways. So this is probably top down, whereas a lot of what we're working on in marital therapy is bottom up, or vice versa. But I do think that this work is very important. And if you haven't been turned on to David Elliott's work, I really strongly recommend it because it allows that. As you get closer, you find that you like it. You find that you want to get even closer, a way that's comfortable for you. So, if you're looking for this, it's in the back of that book. He puts in the index of the book templates for romantic love. And I suggest you study that. It's really, really good stuff. Okay. So then how do you repair this in some ways? But it'd be helpful to have a cookbook of putting all this crap into a formula. So we're seeding the development of the real self. It starts with feeling and teaching a person how to get attached to their emotions in their body. So what we all do in cognitive behavioral therapy is allow a person to have the vocabulary of feelings and teach them the language of emotion and to recognize them in their own bodies. Somatic therapies are incredibly good for this. I have not been trained in somatic therapies. That's why I don't mention it as much. But the dance movement therapists who work with me are incredibly good at this, and I rely on them. But to get in their body and feel is our mindfulness exercises. The mindfulness is allowing a person to be able to attach to themselves, to begin to have boundaries. And most people with disorganized attachment have very, very poor boundaries. And so a lot of what you do in Psychotherapy 101 is begin to teach the person that other people are not them and other people are not going to be like them. So when you have disorganized attachment, what you have is a mind that somehow believes that other people are thinking what you're thinking. And if you feel like you're fat, you think everyone sees you as fat when you're not fat and other people don't see you as fat. So having boundaries means that you know that you decentralize yourself, so you know that other people's minds are going to think different than your mind and begin to understand that, which is part of mentalization. So that goes to 4, which is mentalizing means that your ability to reflect on your state, make sense of the minds of other people, and be able to separate them. And that's 101 psychotherapy. Now, the next step then is beginning to have a meaningful self-narrative. This is where you begin to have a cohesive narrative. I have people do a timeline and begin to look at their emotions, their feelings, and their experiences growing up and fill in some of the gaps. If you don't remember the first 10 years of your life, you probably have post-traumatic stress. So in those narratives, you have to begin to put the traumatic incidences or the misattunements and begin to look at them and take off your rose-colored glasses. And when you do, it's going to be painful. So there's grief work that has to be done and allowing the person to begin to really re-experience those events through the mind in the present and doing really good post-traumatic work. Then 7, you look at the stuck points, cognitive reprocessing therapy, and looking at how one blames oneself because of those traumas and notice the conclusions that they make as a result of the misattunement that think of themselves as defective or bad and begin to do diffusion of those, basically acceptance and commitment therapy, and letting them begin to reprocess so much of what their conclusions are based upon their misattuned childhood. And then 8, to challenge one's continued attachment to punitive critical internal objects. So the way we were treated as small children is the way we treat ourselves. We hear the interject of our parents' voice inside of our head, and we often impose the most antagonizing suffering upon ourselves. We can never escape the tormentor within ourselves. And so in this, what I'm saying is that most of the pain that people are experiencing in adulthood, they've created for themselves through reenactment and repetition. And only by doing the traumatic work from childhood and the attachment misattunement work can you begin to recognize the reenactment repetition patterns. And of course, the number one reenactment and repetition is who we pick as a partner and what we create in our committed relationships. It's the pure form of unfinished business from your family of origin. And then as you begin to reframe that and have the capacity for a loving relationship with yourself, with your children, and your lover, you begin to have some connection. You can be alone with other people. You can feel alone and feel connected with yourself. And you can stop some of those avoidant patterns and allow yourself to have real intimacy and connection, which allows yourself to be happy. And the physiological responses in your mind and your body kind of parallel that in some ways. Okay, so we have about 20 minutes left. I think we can part probably too much information. So let's go ahead and begin to take some of the questions. Suzanne, why don't you come in and help me?
Yeah, I've got a couple of questions that came in the chat and 2 that are in the question section. One question I think is a personal asking, how do we develop self-awareness, self-analysis, and self-reflection in order to better support couples?
Every therapy session I grow. I'm constantly, because of parallel process, my clients are always acting out some of the stuff that I've unconsciously been aware of. So I'm sometimes I think being a therapist, I should pay them rather than they're paying me because it's such a growth experience. And, it's like incredible. So by understanding parallel process, if you look at your own transference and countertransference stuff, it really wakes you up and lets you see, a little bit about your own evolution as a therapist. Most of us got into this business in order to fix ourselves. And so therapists are either in denial or they're in differentiation. And it never stops. No matter how old you are, you're still discovering things. And if you can do that without blaming yourself, but with being just curious and excited, that really helps.
Mark, so how do you work with neurodivergence that can present quite avoidant?
Right. Well, I kind of respect their, neurodivergence. And I try to work within their system in some ways. And so I'm listening to what it is they want. And, every couple has a reactive distance, meaning that some couples have this, some couples have that. So I don't have judgment about what is good for all. I do have some judgment that I don't like people hurting themselves or others. So if I see them really getting into conflict habituated relationships, which Gottman says are the most secure relationships, I'm kind of respectful of that. But if they're in my office, it's probably not working. And so I really want to begin to help them stop hurting themselves and hurting others. So I don't know. There are people who are at different steps in their own growth pattern. If they're neurodivergent, I want them to find a homeostasis of what is best for them. And if it means that your spouse lives in New York and you live in California, more power to you. It's probably a good relationship.
Mark, how might you suggest working with a family in which there are such huge patterns of fighting between three of my sisters, based in my view of disorganized attachment for most of us from our childhoods, and one sister is exhibiting strong BPD behaviors? How would you work with that?
It depends if I can get all the sisters in a room.
Mm.
Then I've got, instead of two, I've got three, and there's three clients in the interrelationships between each. So there's him, and him, and what's going on between each of them. So that's called family therapy. And family therapy, you have to be a genius to do family therapy because, I mean, doing couples therapy, you have to be really smart, but doing family therapy, you have to be a genius because there's so much shit going on in the room. It's bouncing all over the walls that you have to really get more structural and put more containment. People oftentimes say that when they come into our program, it provides kind of a structure that helps them begin to get better. That it's the structure that you put into a family therapy session that allows the healing to begin to occur. So you want to think of it like a building having a frame. Until you have a frame, you can't put in the walls. And the structure comes from, whatever model you're using of family therapy.
Mark, just adding on to the first question, when you have a disparity and you have a securely attached, maybe disorganized attached, or you have both of them that are disorganized attached, how do you actually get the self-evolution in that case with either both or each of the individuals?
It's an interesting question. Richard Stewart, in that book, Helping Couples Change, which I showed you at the beginning, he actually makes a systemic statement, which is he says he has something called the change first principle. And his idea is you take the most differentiated person in a system and you help them become more differentiated, and the whole system changes. And there's a lot of literature on this in the systemic literature. And Richard Stewart created that. So I like that concept, the change first principle, because you take the most differentiated person and you work with them individually. So sometimes a couple will come in and I'll take the one individual in the relationship who's disorganized and I work with them individually. So in our treatment program here, in our PHP program, I would say most of the clients come in with disorganized attachment. And we do a ton of work, 6 hours a day for 2 or 3 months, and help them become more differentiated. Then we put them back into their marriage. And because they've grown so much as an individual, they begin to influence the other, and the other one wants to change too. And so then we do couples therapy, and it's much better. So the answer to your question is I take the most differentiated person, I work with them individually, help them become more differentiated. The problem with that is in outpatient therapy, that can take a year. And the couple are not going to survive a year till the individual changes. So I've created this program here so that I can do a year's worth of work in a month, so that I can help the person get to that point so the couple doesn't dissolve in some ways. And that's the power of an IOP PHP program, if it's really well run, because you can help a person make incredible. It takes individual therapy. We do 3 individual sessions a week, and I would not try to do it with less than that.
Mark, one of the questions was, do you only work with cis couples? And I would say the add-on to that question is there anything to add for non-cis couples that you've worked with?
Yeah, I think the whole lecture is about that. John Money, my teacher, would say you take the extremes and you apply it to the less extremes. Everything I've learned really through working with DID clients. I used to run a dissociative disorders unit. And for 10 years, I worked with multiple personality or dissociative identity disorder. And it changed everything because I learned so much about parts and how parts interact in a dissociative model that now you can feel it in my work, that it it emanates into everything I do. And so, I have an outpatient practice. I work with healthy couples, and everything I've said today applies to them. But a strong portion of them have either avoidant or anxious attachment. They don't necessarily have disorganized, so they're a little easier to work with in the disorganized pattern. But everything applies to them, and actually applies to myself. I mean, there's nothing that I have said today that doesn't necessarily apply to me, and I haven't learned things the hard way. So I have my own avoidance strategies, and hopefully I'm getting less so as I grow.
Mark, we've got one more question here. How to work with clients who are in a relationship with a secure person, but the client themselves is avoidant and anxious, and they see that they're in a good relationship, but they sometimes try to sabotage it or sees everyone else as a threat for that relationship. Similar stuff happens in all other relationships, not only the romantic ones. Clients afraid of abandonment, but always ends up being the one leaving people in their life.
Yeah. So, um, what you just described is normative. I mean, that's the real world, and that oftentimes happen. But if you do research on that, what you find is that if you have a partner who's securely attached, it's probably the best thing for the other individual to begin to move towards earn secure. But usually the person who's securely attached bring them into therapy, and they say, look, I can't fix you. You have to go and get yourself fixed. And that would be securely attached. And when that happens, then that's the best kind of pattern to be able to work with, because I'm turning this over to you, and I'm not going to, so many in those books called like Women Who Love Men Who Hate Them by Susan Forward, or Women Who Hurt Themselves. Those books were all about women who get into relationships and try to fix men. And actually, that pattern is more normal than we really appreciate. And there are forms of that in lots of different ways. Women oftentimes have much more nurturing capacity, both for children and for their husbands or partners if they're in a same-sex relationship. And that nurturing pattern is like a double-edged sword, because they want to help the person, they want to care for them, they want to see the development of the capacity to love. But then in that, the partner fights them with everything they've got, and it becomes destructive. And so what those books teach you is you can't fix your husband, you can't fix your partner, that you can only fix yourself. And then hopefully the person will realize that either they'll need to change or they need to get into therapy themselves and do the work.
And here's a sweet question. I always go after the one who's the least differentiated. If you could comment in on the benefits of that while I do get it, that would be great.
Yeah, that would be a mistake, I think. Going to the person that's least differentiated is not a good idea, because then they feel like they're the problem. And then they end up hating the marital therapist because the marital problem, becomes focused on them. And I think that's why people drop out of marital therapy, is they feel like the therapist is biased by focusing on the one that has the problems. You know, I saw some woman one time, and her husband was a doctor, and she's they came in for the first session, and the woman would start screaming at her husband, hollering at the top of her lungs. You could hear it 3 offices away. And her husband, kind of, can you believe that I put up with this? Can you believe it? And he did exactly what Gottman calls stonewalling. And it's like, God, can you believe this? And of course, what Gottman says is the number one relationship that's going to divorce is a man who's stonewalling. And a woman who's angry is healthy for a relationship. Uh, and a man who's stonewalling is on his way to a divorce. Well, just think about that for a minute. So I get this woman alone for a history, and she tells me this story. She says, I used to be a really cool person, but my husband drives me crazy. The other day, he's a doctor, and we have a 2-year-old at home, and he left the top of her pills off. So she got in there and swallowed all these pills. And I started, it's like, I think he does that just to drive me nuts. And then my eyes lit up and I realized that, I had walked into this dysfunctional pattern and I was working with the lead, the person who was yelling and screaming, but actually it was the husband in his pattern that was driving this woman crazy. And she wasn't crazy. He was driving her crazy. I did a history with him and he said, my mother, when I was 12 years old, said, did you brush your teeth? Did you change your underwear? And it's like, he projected so much of that caretaking onto his wife and he was driving her crazy because he wanted her, when she yelled at him, he felt loved and cared for because that's what his mother did. So the blueprint of how he felt loved was when somebody screamed at him. Well, shit, man. You see it? It's like, so who was the most differentiated? The wife. Who was the least differentiated? The husband. And he needed the work, but she looked like she was nuts. This happens so often.
Mark, will you ever do a webinar on treating sex offenders specifically?
Yeah, we need to do that. Sex addiction, particularly. Sex offenders, I tend to stay away from these days. But sex addiction, I do a lot of. And perhaps I'll do something on that next. Sometimes when I put all this crap together, it feels a little overwhelming. But I've been doing this for 60 years now, even though I look like I'm only 40. And see, I have a good sense of self. And so I've had a chance to be able to blend so many things together, but I never plateau, I'm constantly changing. So that's why I love these webinars. Anyway, thank you all. Thanks for being here. Hope you stay in touch. Bye-bye.
Thank you.